Hello everyone, welcome back. Today's episode we are going to talk about carotid stenting, how it is performed, what are the risks associated with this one, and of course indications. You see there are two arteries which is coming from the front side and two arteries from the back side which goes inside the brain and supply different parts of brain, and also they are connected with each other. Carotid arteries are in the front side, right? So when there is a significant block and the clot is going from there inside the brain causing stroke or stroke like symptoms, or there is ulcerative plaques or different indications. So carotid stenting is a very effective way of treating carotid stenosis, as effective as carotid artery if it is performed by an expert interventionist. And we reach here through radial artery or femoral artery. After reaching over there, we cross this stenotic part using some wire, micro wire, or some other catheters and micro wire support. After crossing this one, we place a umbrella like shield, so that during the procedure, if there is any clot migrate from that ulcerated area or stenotic area, uh, then so that we can catch it. It should not reach to the brain to prevent stroke during the procedure. After placing that one, we do some balloon plasty from inside. So that is nothing from outside. All the things is being done from inside, and we reach over there. We do balloon plasty so that if it is a very tight stenosis, we do gradual plasty using different size of balloon. During balloon plasty, there can have a partial impact on the heart, causing heart pumping, slowing the heart pumping. In medical term, it calls bradycardia. We need to be very careful regarding this one, and that's how sometimes temporary pacemaker is also being placed. And once we inflate the stenotic part using balloon plasty, then we take the stand. As shown here, we take the stand and put the stand in the required area. And once we stand placement is done, we see how much is there any repeat of plasty need to be done, and if required, we do any plasty over there. This procedure hardly takes around 10-15 minutes actually. Post procedure, usually we observe for around 15 minutes more to see is there any clot formation there in the inside the stand itself. And that's very crucial step. And how is the BP and all these things. And after observations, patients is shifted to the ICU. Usually first 24 hours or overnight, we keep the person in the ICU just to have a control about blood pressures and other vitals, which is very crucial. So first 24 hours is very crucial actually, because it is simple way. You have a very tight stenosis, you are going to opening that area, so there will be gush of blood, there will be huge blood flowing inside the brain, which can sometimes give rise to oozing of blood into the brain, causing bleeding. So that can be life-threatening sometimes. So we need to take care of that, and that's why we shift the patients in the ICU. BP monitoring, close monitoring is very crucial. So if you have any queries regarding carotid stenting or indications should be done or not to be done, you can reach out to us. We'll be more than happy to reply your queries. Thank you very much.